Who would have really thought that at an office you could be doing PCR testing for viral particles and for chlamydia and for gonorrhea? That just wasn't available
Yeah,
even 5 years ago.
and now it is.
So things have evolved so much. And the number of vaccines that we give, that has evolved so much.
What is the question? The impact of all the supermarkets giving out the vaccine. What impact has that had on the practice?
Zero.
Really?
Yeah, still come to us for shots, flu shots. You'll lose a handful, but who cares?
Yeah.
There's fistful over there. But
I think that's the beauty of the legacy that you left here too, is people still prefer to come to us for something like a vaccine that they could go to the supermarket for, that they could go to CVS for, but they still prefer to make the appointment and wait and come to us and sit in the waiting room and all of that just for RBK.
Yeah. So I think with everything that we're hearing, Herb, good quality care, provide service, provide access, provide everything in one stop shop for everything, put it into a nice, pretty package with good physicians is what gave me the opportunity to now go to insurance companies and not accept what they give you and negotiate
Yeah.
and sustain us, can keep us going forward because we're different than your regular doc in the box.
And Nick, what do you think? What do you want your legacy to be at RBK? And how do you think, what do you need to do to make that happen?
Obviously, I would think it's a mix. It's the work ethic for sure. It's the commitment to our patients. It's a commitment to our coworkers, our staff. It's more like a family rather than just a place to work. And that's why we continue to have our holiday festivities, and we treat it like a family gathering. So it's nice. We try to find different things to do to keep it interesting. We try to expand our horizons. We developed the urgent care model a few years ago at RBK, and I think that really set our trajectory to the next level. But also on the personal side, family is very important, and it's hard to find that balance. So it takes a lot of sacrifice, don't get me wrong. Everyone has put a lot of work into RBK Pediatrics and at the sacrifice of something at the family level. So it's good that we had that family support, our own family support to help us give our best here, but having a good support system on the other side to balance it out. I think it's that part too that sometimes we don't talk about too much.
I think is we have a lot of docs and we instill the culture into them to step up when needed. We had the emergency on Saturday. I couldn't come in. Neil stepped up, and Neil's on retirement.
Have a 5-day weekend.
And it was a holiday weekend. He didn't say, I'm sorry. He just did. That's the culture we're trying to instill in these doctors to just step up, because one day you're going to ask for somebody to step up for you.
It goes back to the old saying, treat others like you want yourself to be treated. So put yourself in that situation. Next time, be that other individual that you need to step in for. Hopefully we can paint that picture and they can see that there's a benefit to it.
Now with all the EHRs and population health and value-based contracts, we're super computerized in everything. We have telemedicine. We're doing telemedicine yesterday I did the first time where one doctor did just telemedicine. I was full. I was just as full as if I was in the office, and I literally was in the call center. And that helps to be in the call center and talk to the staff if needed. If you put a doctor in, he just fills up. It's amazing.
So Scott, what is RBK today? You're the youngest partner. So how did you find it today?
Yeah. So when I joined, all of this was already established. You'd already set the practice. You'd already defined your legacies, basically, like the theme of everything we've been talking about. We were open all of the time. We were always available. We had great relationships with your patients. That was already established when I joined. Right after I joined is when things like the pandemic started. And so the theme of RBK for me is how quickly we're able to adapt and evolve to all of the changes that are happening now. We went from a brand new pandemic to a brand new test, to brand new vaccines.
A brand new office.
To brand new offices. We were talking about all the new technology and everything.